Hello, my name is Reinemary, and I'm going to talk to you about publication and outcome reporting bias in glaucoma surgical trials. Officially recommended in 2007, clinical trials registration limits publication and outcome reporting bias. The objective of this systematic review is to investigate one, publication bias by examining the proportion of published studies that were statistically significant, and two, outcome reporting bias by comparing differences between the registry and published data in randomized clinical trials. We searched Medline, Central and Embase for RCDs published in English from 2007 to 2021 that compared different surgical approaches, and study selection was made independently by two people. After screening 7,561 articles, 161 RCDs were included. Number of participants in RCD ranged from 13 to 556 per study, mostly adults suffering from primary open-angle glaucoma. Of those, only 56% of studies specified their main outcomes. Close to half of the trials presented statistically significant results. 63% of trials were not registered, and only 9% of trials were registered prior to patient recruitment. When comparing based on registration status, the direction of trials outcomes difference did not significantly differ. Table 2 outlines outcomes reporting. Among the 60 trials that were registered, 6% did not present complete data, allowing us to analyze 56 trials. 37% of the study showed discrepancies between objectives in clinical trial registries and the published results, which shows outcome reporting bias. 18% had new primary outcomes in the published article. Figure 1 presents the registration status based on the year of publication of the studies. We can perceive over the years an increasing registration incidence while the number of unregistered clinical trials remains similar. The number of clinical trials in glaucoma surgery has increased in the past years, and our results demonstrate that the majority of RCDs were not registered, which remains an important source of bias affecting transparency, although there was some improvement. Although there was publication bias as statistically positive studies were not published, more published, finally, 1/3 of registered trials presented the outcome reporting bias. Although there are no published reviews on the same topic, our results are in line with research methodology guidelines, encouraging trials registration a priori to improve transparency and accuracy of findings. Our review has some limitations, and despite its limitation, we still have some strengths too that are written down here. Finally, registration a priori of RCDs is essential in order to ensure greater transparency and therefore an accurate interpretation of findings, allowing better decision-making in clinical practice. Thank you.